all. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to the show. Today we will discuss about a very exciting, potentially useful therapy for COVID-19. And the drugs in this category are going to be the Galectin inhibitors. So let's start our discussion. Again, the discussion today, let me just give you a quick synopsis of the discussion, and then you can stick around to see the mechanism if you like. The synopsis is that lectins are part of our body. They are small molecules that are roaming around everywhere. They connect with some of the glycoproteins, and they connect and they cause a few things. One of the mechanisms that they do is that they cause inflammation, or they promote inflammation. And the other mechanism that they do is that they cause the some of the cells to become activated, and we'll talk about that how does that activation occurs. So today what we are going to do is, and plus one more thing, in case of the viruses, especially the coronaviruses, it is possible that the S protein of the coronavirus has a part that looks like a lectin or a galactin. And so if we have the Galectin inhibitors, that might block the SARS-CoV-2 or SARS-CoV-1 or MERS-CoV, the coronavirus's spike protein. Similarly, they can reduce inflammation as well, the inhibitors. So that is a discussion today. Let's start our talk. All of the discussion here, there is no study. There is the studies that are done, which I would discuss with you, are either on MERS-CoV or on SARS-CoV-1. There is nothing for SARS-CoV-2, number one, and number two, the studies are either in vitro or on the previous viruses. So let's start. So here, this is Drbeen.com, and if you are looking for the lectures, I have started uploading some of those lectures here on Corona Information Center. We are a little behind, but these are also present on the video library as well. And what you can do is that you can just sign up from this try for free now. If you only are going to watch the coronavirus videos, even when the free trial expires, you can continue to watch. These videos will not expire for you. The rest of the content may not become available. And if you bought it, that is awesome as well. Okay, so with this, this is the study here, the description, not a study, this is an article. And this article's link is present in the description with the video. This is another tiny article about what are lectins. So it will be interesting for you to look at lectins as well. And now let's look at their mechanism. So once again, welcome to everyone. So galactins or lectins are of many types. And we would specifically talk about the galactin 3. Lectins are small, tiny molecules. So here, this little molecule is a demonstration or an illustration of a lectin. What they do is that in our body, so imagine that this is a cell. This was a cell or is a cell. And on the cell protein, we have small proteins attached, and on the surface of the cell we have millions of proteins attached. Some of those proteins are glycoproteins. What that means is that they are proteins, but they have small molecules of sugar or glucose attached to them as well. This is why they're called glycoprotein. So they are protein with a glyco attached to them or a sugar attached to them. The lectin molecules that are roaming around in our body, they bind with these glucose parts of the glycoproteins, and then they do various functions. An example will be for the immune system, because it is really related to immune system, that the discussion that we are doing today. So imagine this is a monocyte or a macrophage or a dendritic cell. Remember, we talked about it in the past as well, that these cells, these are the innate immunity cells, macrophages, dendritic cells. They have small molecules on their surface with which they bind with the viruses. So one such example is Mannose binding lectin. So check out the name, Mannose binding lectin. So this is a lectin protein attached to an immune cell, and it would allow this immune cell, the macrophage or the dendritic cell, to connect with the viruses or the bacteria. So it is a mannose binding lectin. There are other as well. For example, there are PAMPs receptors that also bind with the pathogens. There are toll-like receptors that also bind with the pathogens. MBLs are also one type. And today's context is MBL. Now, some of the functions that these lectins do are, number one, they are used for cell-to-cell adhesion. Cell-to-cell adhesion, many cells, for example, immune cells will come in contact with each other and connect with each other. We have talked about this. For example, macrophages working with the naive cells, or the cell-to-cell adhesion, for example, in the blood vessels. If I make a blood vessel over here, we have done this discussion many times that on the endothelium of the blood vessel, there are adhesion molecules, and these molecules would allow the other cells, for example, let's say monocytes that are roaming around in the blood, these will be connecting to the endothelial cells, and then they would migrate out towards the site of infection. So this cell adhesion, where one cell binds to another cell, maybe temporarily, are also done by the use of lectins. Both surfaces of both cells have lectins projections on them that can connect with each other. Similarly, they also help in glycoprotein synthesis regulation. So for example, in liver cells, there are lectin on the surfaces, and then the liver can actually figure out how much more proteins to make or how much more fats to make. Similarly, other cells have the lectins on them as well, which would help them, the cell, to understand, should I make more glycoproteins or not? In another function, blood protein level regulation is also is helped by lectins. And this would be, again, the cells in the liver, when the lectin would attach to them, that would give them a signal to make more proteins or not. Then, as we talked about it, binding extracellular and intracellular glycoproteins, that is the function of lectins. They are receptors on the liver as well, as we just talked, and they are very important part of the innate immune system. If we didn't have mannose binding lectins or other receptors which have lectins in them, the innate arm cannot work very well. So these are some of the functions of lectin. And the discussion today is lectin blockers, inhibitors, not the lectin itself. So before we go to the inhibitors, where are the galactin-3 specially present? And look, excuse me, galactin-3s are present abundantly in lungs, in brain, and in GIT. These are the tissues where galactin-3 molecules are present abundantly. And this is a hypothetical connection as well, that if you see COVID-19's target are, of course, lungs. So respiratory diseases are very common, or the most common thing with the COVID-19. So pneumonia or ARDS, etc. Similarly, from the GIT side, we know that COVID-19 or SARS-CoV-2 causes GIT symptoms, which can be nausea, vomiting, diarrhea, abdominal discomfort, pain, and so on. Then galactin-3 is present in the brain as well. So especially in the cortex and the hippocampus of the brain, parts of the brain. And we also know that in COVID-19, patients can experience seizures, anosmia, cerebrovascular events, impaired consciousness, muscle injury, and so on. The point is that the authors of this paper, and here is the paper, this is the paper, what they are doing is they are connecting the presence of lectins with the severity and location of the disease, especially with the COVID-19. Okay, so now continuing on, what we know so far is there are lectins that are present in our body. Number two, lectins can connect with the cell surfaces, and they have different functions over there. Number three, lectins are abundantly present in the lungs, in the brain, and in the GIT. Now, galactin-3 and the COVID-19, how is it that galactin-3 inhibitors may help with COVID-19? And the benefit is the following. If we give galactin-3 inhibitors, and I'll talk about the mechanism in a second, then it is possible to reduce the viral binding to the cell surfaces. Can you tell me, so now today is the cool bean test for all of you, can you tell me some other drugs that may inhibit the viral binding? So I'll give you 3 seconds. 1, 2, 3. Number one, of course, we know that hydroxychloroquine can cause ACE2 receptor modification, and that can reduce the binding. Then we also know that hydroxychloroquine makes the intracellular environment a little basic in nature, and that causes less fusion of the virus to the cell membranes. So that is hydroxy. Then we also know, remember bromhexine, which would block the TMPRSS2, which would then not prime the S proteins of the virus, and the virus cannot then bind with the ACE2 easily. Then remember camostat mesylate, that also is a TMPRSS2 blocker, and TMPRSS2 once again would cause the priming of the S proteins, and so the virus cannot connect. There is an answer here. Steroids. Steroids will not reduce viral binding. Steroid would reduce the response of the body to the virus. So when the virus arrives in our body and it goes into our cell and causes the damage, that damaged pieces of the tissue will not cause too much of the viral of the immune system response. So steroids are a little different. But the camostat mesylate, bromhexine, that category of drugs that block TMPRSS2, hydroxychloroquine, or any other drug that would cause intracellular environment to become basic in nature, that would reduce the fusion of the virus. And then there are many other antivirals that can reduce the viral fusion. Here we are also seeing galactin inhibitors can reduce viral binding. And we'll see what is that mechanism. Second way they can help, galactin inhibitors, are that they can help suppress the immune system and reduce the cytokine storm. So once again, the cool bean test here, what drugs have we seen that can suppress or reduce the cytokine storm? You guys are all cool beans are now almost immunologists. So of course, as James has said a few seconds ago, steroids are one that can suppress the immune system, and they can suppress the cytokine storm if given at the right time. Then, of course, there are multiple other drugs that we saw, for example, leronlimab, itolizumab, then a few other drugs that we'll come across in the next part. These are also cytokine, for example, anakinra. These are cytokine storm blockers as well. So this drug, if it is tested and tried, at least from the studies on other viruses and computer simulations, and from the mechanism of action, it seems that galactin inhibitors can be useful. They would have two basic mechanisms. One, they would reduce the virus binding, and secondly, they would reduce the immune system response. So this is a very good question. Somebody is saying, Holy Angel is saying ACE2 inhibitors. So ACE2 inhibitors, this is a big discussion which is still going on in the medical community, that ACE2 receptor blockers and ACE2 inhibitors, can they really interfere with the virus or not? I haven't still seen any deterministic, any definite answer yet. Okay, so continuing with the mechanism. So here is the first mechanism. How does galactin inhibitor may help reduce the entry of the coronavirus or SARS-CoV-2 into our cells? So start from here. So this is a coronavirus, SARS-CoV. And if you see here, these guys have spike proteins, and we've been talking about their spike proteins for some time. And we know that their spike protein, if I draw a spike protein over here, these spike proteins have multiple domains, right? So they have a S2 domain, and then they have an S1 domain. S1 part of the spike protein is also called to have a receptor binding domain in it, which binds with the ACE2. And the receptor binding domain itself is then divided into two parts, or it has two ends. And those two ends are, and this happens with the proteins. Proteins have an N end, and a C end. So this has a C terminal and an N terminal. All proteins have that. Normally, the receptor binding of the spike protein occurs, the ACE2 receptor binding occurs at the C terminal. The receptor binding part of the spike protein, and then within that, the C terminal part of the S1 part of the spike protein connects with the ACE2 enzyme. But this second part, the N terminal, is also essential for the binding. What this part does is that it binds to a nearby ganglioside. So that is a glycoprotein. So it connects to a nearby ganglioside, and these two, they both have to be connected for the virus to actually then start fusing with our cell membrane or becoming endocytosed or eaten up. Now, here is the interesting thing. Galactins, not inhibitors now, galactins are very similar in structure to the N terminal of the spike protein of the coronavirus. So their structures is similar. The lectin molecule and the N terminal of S1 part of the spike protein, they look very similar. That means, hypothetically, if we give a galactin inhibitor, that might look like an S1 part, N terminal part, and that might go onto our cell and connect with the GM1 ganglioside. So that is a proteoglycan glycoprotein I talked about. And they would actually go and occupy that site. And now when the virus S protein is going to try to connect here, that will not be able to connect very well. So what does this mean? So if we look at the connection or the binding of the virus to our ACE2 receptor, first of all, we need TMPRSS2 to do the priming. So if I go here for a second, if you'll see this little guy over here, this is TMPRSS2. That guy does the first function of priming the spike protein. Then once the spike protein has become primed, then it has an S1 unit, that is this part, and an S2 unit, that is this part. So let's forget about S2 unit. S1 unit in turn will have two units in it. One is or two ends of it. One is the C end, that is the end that connects with the ACE2 receptors. And then they also have an N end or N terminal that connects with the GM1 glycoprotein. This N terminal is very similar in structure to galactin 3. So if we give galactin 3 inhibitors, they are going to come in and bind here and block this part. So now even when the SARS-CoV protein is primed, even when one part of that is connected with the ACE2, the other part that was going to connect with the ganglioside will not connect, and the virus will not be able to bind correctly. So that is the basic mechanism of galactin inhibitors. This mechanism has been observed in two ways. I want to make sure that we understand how authentic this may be. Number one, in SARS-CoV-1, it has been studied, and it has been studied with simulations, that is computer simulations. You take the SARS-CoV spike protein, you take the ACE enzyme, and then through computer you see can they bind with each other or not. The second area where it has been studied, the galactin inhibitors, are on the MERS-CoV viruses in mice. So these are not studies that are in humans. They are either computer simulations or they are murine models or mouse models. However, this is one of the functions. So what is one function of one possible function of galactin 3 inhibitors? They will reduce or possibly block the binding of spike protein with our cell. And how would they do it? They would block the GM1 part, the little receptor on our cell surface. So hopefully this is good. Now the second part of the mechanism, how are the galactin inhibitors anti-inflammatory? So start with this, that lectins are pro-inflammatory. So if you look at this guy over here, this is a dendritic cell. And the dendritic cell is a macrophage. And we have been talking about these cells for some time. So if I very quickly draw the map here, remember we talked about macrophages here, then it would connect with the naive T cell. Then naive T cell will become T helper 2 in the presence of interleukin 4, or T helper 1 in the presence of interleukin 12. And then T helper 2 will release interleukin 4 and interleukin 5 and cause the B cell to become active, which will make more antibodies. And T helper 1 will then connect with in the presence of, I believe, interleukin 2. It would activate the cytotoxic T cells, which are CD8 cells as well. And they would then kill the other infected viruses. So this part, this is the adaptive arm. And this side is the innate arm. Innate arm has natural killer cells in it, that has macrophages in it, that has dendritic cells in it, that has monocytes and other cells. So we are talking about this area, and we are talking about the macrophage and dendritic cells. So that is one of the cell over here. So imagine this is an infected macrophage, or this is an infected dendritic cell. When the dendritic cell is infected, when it has the coronavirus in it, and then if there is the presence of a galactin molecule that connects with its GM, or let's say Mannose binding lectin, or with the GM1 proteoglycan, when the galactin 3 is present, then what happens is galactin 3 causes the second messenger system. That is, imagine that galactin 3 rings the bell from outside of the cell on the surface of it. And that bell causes a sound inside. So instead of the sound inside, there are chemical processes that occur inside the cell as a result of the galactin binding on the outside. This is called a second messenger system. So this second messenger system becomes activated, and it causes the nuclear factor kappa B to become active. Nuclear factor kappa B then goes into the nucleus, and it causes the gene expression inside the nucleus, which then causes the nucleus to start making messenger RNA, which would then result in production of interleukins. Interleukin 1, interleukin 6, tumor necrosis factor, and many other. We have seen them. Interleukin 8, interleukin 12, and GM-CSF, and so on. So galactin's presence, keep now this in mind, will eventually result in the dendritic cell releasing these interleukins. And please also keep in mind, we have done these discussions in the past. There have been drugs that we have talked about that can block these individual interleukins. For example, interleukin 1 can be blocked by anakinra. And this is anakinra is an interleukin 1 receptor blocker. So once interleukin 1 is released, it has to then go into the other immune systems, and it has to go in the liver, and it has to act on the other cells. And the interleukin 1 receptor is blocked by anakinra. So that is one kind of a blocker. Then we've also talked about tocilizumab. Tocilizumab is an interleukin 6 receptor blocker. So once the interleukin 6 has been released, that interleukin 6 would go into the other immune cells and activate them. And for that, it would act on the interleukin 6 receptor, and tocilizumab would block that. Then we have talked about tumor necrosis factor alpha. When the tumor necrosis factor alpha is released, that would also cause activation of the immune system. And there are drugs, we have not talked about these drugs in the past. For example, certolizumab or infliximab. These would then suppress the binding of tumor necrosis factor. So the takeaway from this little diagram over here is, in the presence of galactins, the immune system cell go mad, and they release a lot of cytokines, which in turn would cause the immune system to become activated. So that means if there is some way for us to suppress the galactin by giving, let's say, galactin inhibitors, then it is possible that these interleukins will not be generated in the same amount, and the cytokine response will not be that bad. So that is what we have here. So imagine now this is a healthy cell, or even if it is infected, this cell has its CD44, or the receptor area where galactin was going to connect. Over there, a galactin inhibitor drug is attached. So now if you see here, this galactin molecule is sitting on the side. It is crying because it cannot connect with the cell. And the result is that now this cell, instead of making more interleukin-1, 6, and tumor necrosis factor alpha, it reduces their production and increases the production of interleukin-10. And I think some of you, Cool Bean, may have remembered, interleukin-10 was also released by the T helper 2 cells. And the interleukin-10 production, in turn, causes, number one, suppression of the T helper 1 system, and number two, it suppresses the innate arm. So it kind of calms down the immune system. This is why we say that the T helper 2 pathway is anti-inflammatory and T helper 1 pathway is pro-inflammatory. So this interleukin-10, which also comes from T helper 2, also is released by the dendritic cells if they have presence of galactin blockers. So they switch their behavior, and instead of giving interleukin-1, 6, and tumor necrosis factor, they start releasing interleukin-10, which is actually anti-inflammatory. So not only it reduces the immune system behavior, it actually is going to counter that behavior as well. So this is the basic drug mechanism. Two mechanisms, two things it is doing. It is suppressing the immune system, and it is causing the virus not to bind correctly or easily. Now, what are the drugs that are in this category? So this is the last topic for today. There are Galectin-3 inhibitors that are already present and have been used for other drugs, and they are in trials. So there is nothing in production. These are in trial. So one such drug is the TD139. This drug is in phase 1-2A. This is a Galectin-3 inhibitor, and it has been used, or it has been tested for idiopathic pulmonary fibrosis. So that is a condition in which the lungs of a person, they start getting scarred and fibrosed, and the basic reason is not known. It is probably genetic or other secondary things, but idiopathic means unknown. So for some unknown reason, the lungs start getting destroyed and they start becoming scarred and shrunken. So this TD139 is used for that, or is being tested, trialed for that. Then there is another drug called GRMD02, or Bellopectin. This is in phase 2. It has been done with phase 2. Now it is in progress with phase 3. So again, this is also in trial. And this has been used for NASH, non-alcoholic steatohepatitis, which in simple ways, of course, alcoholics can develop fatty liver, but this is the people who are not alcoholics and they still are going to develop the fatty liver, and NASH is that condition. So what happens is in NASH, one bigger problem that occurs is that, look, from our GIT, the blood goes to liver first. So when we eat something, all the things that we have eaten from the GIT, when it is absorbed in the blood, that blood goes directly to the liver. Liver gets a first chance to inspect that blood, to detoxify that blood if needed, and to take care of the materials that we may have eaten and are not good, to remove them. So liver receives the blood from the liver, then that blood becomes part of the circulation. Now, if the liver itself is not healthy, if it is scarred, for example, cirrhosis, or if it is fatty, for example, this condition here, NASH, in that case, what would happen is that the heart will send the blood. Let me bring my screen back here for a second. I'm doing some hand waving. So what would happen is that the heart will pump the blood and send the blood in the GIT. But the GIT would then in turn cannot send the blood to liver easily because liver is choked up. So that means heart is now pumping with force blood into the GIT blood vessels, and that blood is not returning easily. So blood vessels in the GIT would start swelling up. That would cause varicose or varices in the GIT system. That would cause portal hypertension. That causes bleeding. Many of the patients of the liver cirrhosis or liver NASH, they would have the hemoptysis and bleedings, and that is one of the reasons that they can die. Other reasons are the coma and other complications. So back here to the to this diagram here. So there is another drug, that is the Bellopectin, that has been used to see if it can reduce the NASH. And especially when it is used, it has shown to reduce esophageal varices. That is the blood vessels that are swollen in the esophagus, which would burst and cause bleeding. And it is also seen, has been observed to reduce portal hypertension. And that is the extra blood filling in the GIT. So this is probably because it helps with controlling the NASH itself. So that is the two main drugs. There is one more drug that is being developed. It is Galectin-1 inhibitor, and it is directed towards COVID-19 infected patients. So that is the discussion for today. Fascinating drug, Galectin-3 inhibitors or Galectin-1 inhibitors. And there are no studies yet on COVID-19 itself, but there is a hypothesis here, there is a conjecture here that these drugs can help. So studies are needed. So this is the discussion. Let's answer a couple of questions. Tomorrow we will have an open forum. So please submit your questions today so that I can be prepared with them. And tomorrow I will answer those questions that have been submitted now, today here on YouTube or Twitter. And then I'll look at the live talk as well and discuss that. Okay, so questions here. Vitamin D3 toxicity is rare. How many IU were you taking? So I think that is a discussion going on here. Bellopectin is exciting, also shown to reduce the expression of TGF-beta in myeloid cells. So Mark Rice is here. Very good. What are the side effects? So that's a very good question. The drug that I just talked about, the Bellopectin, so far, I think its dosage is 2 milligram per kilogram body weight, and it is given twice a week in infusion, and it has been shown to be safe. So that is so D3 toxicity. So there's a question, what is the D3 toxicity? Look, vitamin D3, I have taken in large doses as well. I have given in large doses too. For example, 5,000 international units per day, I have taken that by myself. There are some patients that I've given in large doses as well. Normally, it does not cause that much toxicity, but because it is a fat-soluble vitamin, it can get stored in our fats, and it can, if taken in too much of the amount, it can cause GIT irritation, and it can cause side effects. Excellent. So guys, thank you very much for today. I will continue our discussion tomorrow. We'll do an open forum. If you have a question, please put that here or on Twitter. We'll discuss. We'll have heart-to-heart discussion tomorrow, and then we'll go from there. Meanwhile, stay safe, happy, healthy, and please like, subscribe, and share. Thank you. Bye-bye.